Bad things that can happen. High blood pressure can cause a heart attack. If you're from the Caribbean or from Africa, you believe in natural medicine only. You don't want to take pills. You believe I'm taking that natural remedy. They say it's good for blood pressure and I'm fine. But without checking the blood pressure, measure your blood pressure. If it's normal, we're done. Thank God. But if it's not normal, take my medicine. Yes, you can go do those things that you believe in, but also use medications. Now, let's talk about the bad things that can happen to you or anyone. Do not treat blood pressure, who does not take medication, doesn't do lifestyle changes, who lives in denial. Those are the bad things that can happen. High blood pressure can cause a heart attack. Okay? Big time. You can also cause what we call aortic dissection. It's a fancy name to say the biggest blood vessel in your body called the aorta. You can blow that up. You can also develop heart failure, where the pump of your heart drops significantly because of the effect of blood pressure in your heart, or the performance of that pump, not only the systole, which is pumping, but also the relaxation part to receive blood. Those are impaired, and that can also give you heart failure, which is also a very bad disease. In one of those episodes, we'll talk about it. Other things that can happen, you can develop atrial fibrillation because of the enlargement of the chamber, especially the top chamber that are smaller, have less muscle mass. So the effect on those blood pressure make those chambers called atrium enlarge, especially the left atrium. And when it enlarges, instead of pumping like that, it does that because it's enlarged, and that's called atrial fibrillation. In that time, blood is not moving the way it should be moving in your heart, and it forms clots. And imagine having a blood clot inside your heart and you throw it out. What can happen? Block an artery in the legs. So you can also have peripheral arterial disease because of that, because of the damage that happened in any vessels in your body with blood pressure. Can also happen in the vessels in the leg. It can happen in the vessels in the kidney, where you develop plaque inside that vessel because of damage of blood flow going to the kidney. And the kidney responds by trying to regulate blood pressure and make it even increase even more. So all of that can be because of high blood pressure that's untreated. You also can have eye problems, visual change. You can also have problem in the brain with dementia. We call that vascular dementia because of diffuse plaque atherosclerosis, because of the blood pressure effect in your brain causing vascular dementia. That can also precipitate or exacerbate symptoms of Alzheimer's dementia, okay, because of high blood pressure. You can also have impotence, sexual impotence with high blood pressure, both male and female, okay? All of that are in play. You can also get a stroke. You can have a bleeding stroke, we call hemorrhagic stroke, or you can have a thrombotic stroke, where you throw one of the small clot that, because of damage blood pressure does inside your vessel, you form a small plaque there over the months or years, and then you throw that up and you close a big vessel in the brain, you get a stroke. The whole right side is gone. Now you cannot speak, or you cannot control, your time to go to the bathroom. You cannot walk by yourself. People have to feed you. So blood pressure is important to control because you can prevent all those complications. Now, another important topic to talk about high blood pressure is really the cultural beliefs about hypertension. In every society, there are some beliefs. For example, in African society, where some people believe it's because of stress, it's because I'm not happy, it's because of my problem with my family, all of that exacerbates hypertension. But I always tell you, you've been having stress all your life. Why now? So there are some things that change that give you hypertension. There are also other cultural beliefs in South Americans, as well as the Caribbeans and Africa, regarding it's a evil spirit that give me high blood pressure, witchcraft, voodoo, like I'm from Haiti, for example. Yes, you can go do those things that you believe in, but also use medications that will provide. Often people, they are almost in a state of denial. I'm taking that natural remedy, they say it's good for blood pressure and I'm fine, but without checking the blood pressure. I do that ceremony, that ritual, now I should be fine. In some culture, they believe if you wear certain jewelry, that will help with the blood pressure. All of that, you should not minimize it, but measure your blood pressure. If you go see a voodoo priest and you take care of the blood pressure now, measure it. If it's normal, we're done. Thank God. But if it's not normal, take my medicine. You can go back to that priest or wear that piece of jewelry or whatever you believe. That's fine. But take my medication with that jewelry and that will help. Okay. And the number you look for again is 120/80 or less. Do some exercise. Take away the salt. That's probably the biggest culprit. In your diet. Move. This is so important in order to find really treatment for high blood pressure and to prevent some of those complications, because it's a big, big epidemic worldwide that causes a lot of problems in our communities. In the future also, there are extensive researches being done to treat hypertension differently. Okay, we have genomics researches being done to target certain treatment for high blood pressure. We also have artificial intelligence to treat high blood pressure in certain populations. Certain populations respond well to that medication versus others who don't respond well. We also have other drugs that's coming out that looks to be very good for the future. We also have probiotics and prebiotics that can be used to change your gut flora, which means the bacteria that reside in your guts, to see how that affects blood pressure in certain individuals and use that to treat high blood pressure. In conclusion, know your numbers. Okay, know your blood pressure. Okay, if you have a problem with blood pressure, check it every day until you get it controlled. Once you get it controlled, you can go weekly, bi-weekly, or even every 2 weeks or every month. But you got to make sure you get that control and you maintain your lifestyle that you change. You maintain that change. You stop drinking, stop smoking, stop any drugs, and keep your weight at least controlled. Watch what you eat, your diet, what type of food you eat. Salt, which is very hard to do because most people, by the time you get to lunch, you already pass 4 grams. But if you read labels, then you read the food, try to use less processed food and more natural food, then you can manage at least to be around 2.5 grams, sometimes 3 grams, and pick a day of the week to cheat. That's what I do. You enjoy whatever you like to eat, and after that, you give back. Give back for me is go play with my kids, go on a walk with my family, with my wife, or golf, because I love to golf, walk the golf course, not sitting on a cart riding, walk the golf course. That's me. And then after I do that, I control my blood pressure, things are better. I also control my blood sugar, things are better. Then I pick a day I cheat. I go and get a cheeseburger, whatever you enjoy, you do it. Because life, you got to find that balance, Perfect is the enemy of good. We're not asking anybody to be perfect here, but you got to be aware of those diseases and treat them to prevent complications. If you know your numbers and you manage your numbers, more likely good things will happen. Again, thank you for listening. This is powered by Tocordia, the health management solution for you. Remember to click on subscribe button to see our next talk on this channel. Again, thank you.